ਹੁਣ ਤੁਸੀਂ ਕੁਐਸਚਨ ਕਰੋ ਨਾ।
ਸੋ ਡਾਕਟਰ ਸਾਹਿਬ ਆਪਣੇ ਜਿਹੜਾ ਲਿੰਕ ਹੈਗਾ ਜਿੱਦਾਂ ਮਾਲਾ ਨਹੀਂ ਹੁੰਦੀ, ਮਾਲਾ ਦੇ ਮਨ ਕੀ ਆ
जी
है ना, तो एक होना जो हैगा आयुर्वेद, दूसरा योग,
या
तीसरा
हिंदी करो जो सभी समझ आएंगे।
हाँ,
हिंदी में करोगे तो सभी समझ आएंगे।
हिंदी इतनी हमारे को नहीं आती है।
अच्छा, कोई जितनी आती है उतनी छोटी सी कर लो ताकि दूसरों को जो इंग्लिश में बात करो।
So
इंग्लिश में भी कर सकते हैं हम।
So basically, as I was requesting you
जी
that like in a mala which is made of each mantra. So think of each mantra like one for Ayurveda, one for Unani, one for Siddha, one for yoga, one for homeopathy, na? So what is the link with the great work that
how can we make the link with the yoga and Ayurveda?
So the great work that you are doing through your research, how in your opinion is a link between
yoga and Ayurveda?
Yeah.
Yoga and Ayurveda, they are linked, no doubt. At the same time, when Ayurveda is come in the world, yoga is also come same time. Many people think yoga is different than Ayurveda. Yoga is keep you healthy every day. You no need any medicines if you look after your body, work with your body, then your all the organs start helping you. If a brain start helping you, in the yoga, the most of things on the body, muscles, joints, brain, meditation, these are all things keep person healthy. Problem is, I'm always say in many my treatment, if I see something, he need the yoga. For your information, I made is 2-3 different type of the exercise, yoga exercise.
Yeah.
I say this is what do you say, small Kapalbhati, and I send you that video. And that one is, there's one big patient came, his lungs collapse, and he can't do any exercise, he can't do any yoga. When person's body not allow, how can you do the yoga? You can't do the meditation, you can't sit down, you can't walk. You need that time proper medicine. When become person's healthy, then start yoga, then keep him healthy. This is my opinion. Problem is now is yoga and Ayurveda, they don't want to come together. Yoga people say, oh, do the yoga, no need any medicine. We can cure with the, definitely you can cure. You not mean cure, but you need the with the Ayurveda and yoga together. If they work together, when person's health is becoming okay, reasonably online, then yoga boosts that his health more. They should work together. Some people say no, yoga is only okay. Other thing is not. And Ayurveda people say you need the treatment, and definitely when body, when organ is anything problem, you need the treatment. After treatment, yoga is make them, if the person with the medicine becomes 6 months, relieve their all the things. If we start yoga after 1 or 2 months, give the small exercises, very light exercises, need the professional yoga teacher. We have so many yoga teachers now.
Do you think it's very important for the yoga therapists or yoga people to understand a little bit about Ayurveda? Because otherwise, if there is a certain condition that they are not aware of, and so they're just saying, do this posture, do this posture, do this, and that might actually be more harmful.
More harmful because you are yourself is master of the body modality. You are the best teacher in the whole UK, Bhamraji. You understand if the joints are not normal, if there are a lot of inflammation or infection inside, you and I, we do, I do the spine therapy, and you do the full body, you teaching this one, and then they damage more. Then CRP go very high in the body inflammation. Then people say, we try the yoga, we try the Ayurveda, can't work. It can't work. yoga teacher, if they become Ayurveda practitioners, that's very good. But otherwise, they have to discuss with the Ayurveda professionals. Ask them what we can do. This person is come to me for the exercise. But this is his problem. Take the proper report and then discuss with the Ayurveda person and tell him how can we reduce his inflammation, reduce his infection from the joints. That is work. If you can't do that, like you said, this is we need. We need to come together, don't shy from each other, and respect each other. And if the case is like a normal, teach the yoga person. If that person have difficulty in the joints, don't force him. I many cases, Dr. Joshi know, everybody know. I say no. I on not even touch their spines, any joint. I do the with the medicine. I cure that one. Then I say do this exercise now. Then they're doing no any problem. So this is very important question you raised today. I think we need this one. Yoga and Ayurveda teacher, they work together.
And what is your thought about because obviously, all the great work that you along with your colleagues is doing here, Dr. Raghunandan ji, Dr.
Joshi ji,
Venkat Joshi ji, and
Dr. Chavla.
yes, and Dr. Chavla and Dr. Hina, Dr. Hina, you remember?
I know, I remember Hina. He's
She.
yeah, she. I know.
Yeah. I mean, all your people are doing so wonderful
Yeah,
work.
it's a wonderful. There's the only, I think, 2-3 people are discussing more, very genuinely.
Yeah.
Dr. Joshi and Dr. Raghunandan and Dr. Kapil Chawla, I must say.
Yeah.
Other people, they listen the video.
Yeah.
They. I hope they discuss on that one.
Yeah.
Many things I say.
Yeah.
They say, how can we do this one? This is word should not be in the Ayurveda.
Yeah.
How can we do the cure the person? No word.
Yeah, so actually, what I was going to try and ask you was that, I mean, all this wonderful work that you and your colleagues, Dr. Raghunandan ji and Dr. Venkat ji and Hina ji and all the Ayurveda doctors here are doing. I mean, this is a knowledge, that comes from India.
Yeah, definitely from
Now,
India.
the same thing, whether, it's to do with somebody who's teaching yoga in Croydon, or somebody teaching yoga in London, or somebody teaching yoga in Birmingham, whether they've learned it from an Indian master or, somebody, went from UK to India to learn this and has come back and is teaching yoga. Essentially, the root of yoga is from India. So what is your impression about now we seem to see a lot of, Gurujis coming from India and they have their own model of yoga. Now, do you not think that it's right, for them to disseminate some knowledge on Ayurveda before they actually, license somebody to become a yoga practitioner?
I don't know that the system, the maybe government can start this one. That is, I can't do anything, but I can only give my views. Like you asked the question, there's so many. Like I'm doing the Ayurveda, I'm done a lot of researches. I changed the system of Ayurveda, how to treat. Many people say, how can you do it? I say, no, we have to modify Ayurveda now. Otherwise, we have millions of Ayurveda practitioners, and we are still not reach where we should now in the India and everywhere. Why? There's two reasons. I definitely comment on that one, because in Ayurveda, not all the people are practitioner. Some are teacher, some are practitioner. They should be recognized. Should be not confusing in the they should do they are master on the teacher. They not say no, but they should become the practitioner. They should more practice. They need only practice. When they do the practice, like Dr. Joshi ji and Raghunandan, they follow my idea. I tell him so many times, if you can do it, that treatment, start. If you can't do it, can't understand what is this problem, then don't start. Otherwise, we losing our hope in the people. People think, oh, we done the Ayurveda treatment, but the patient don't know how expert was the person is proper, he know the job or not know the job. Is only write it down the Ayurveda practitioners know. Everybody is not perfect in everything. I'm doing Ayurveda 55 years now. I'm also say, I'm sorry, then I do the study because I work on the organs and glands. This one I change the system. Ayurveda, last time you done the video, I say Ayurveda is very easy. Remember? And Dr. Joshi and you say, how can be easy this one? I say, very easy now. Which way I made the system, I designed the system, for me it's become easy. If everybody Ayurveda will do the Zoom meeting, everything, discussion need to be discussed with each other. Need to be Zoom meeting, need to be ask the how you do it. Not stay on the formulations. That formula is good, but now we need the different kind of formula. They even allopathy, we should learn from the allopathy. Allopathy done the great job. I respect allopathy, always say. They teach us how can we do it better than them. We learn from there. This is I learn from there. Become one thing is perfect. As my guru, when I told this one, not everything you say you can know. Even I can't do it. But we are say, okay, let's giving a patient, don't try anything. You should be sure you can do this job or not do. If you have 50% confidence, give just 1 week medicine. If we can't cure it, find your friends. We have to make the one association. I told you so many times. Make one website. They should write it on what kind of they are professional. Not Ayurveda. We are Ayurveda doctor. Ayurveda have very wise system. People have, oh, you can't count. They have the problems. And which way I design? How can I treating the Alzheimer patients? Hospital say cancer patient, others worsening. About the COVID, how can I say at that time? This COVID, what they're saying, this is not that one. I made nearly 10 videos, so many messages, and all becoming true. I told in that one, they making excuse and selling you the vaccines. This is very hard, I told in 2020, 21, 20. But Ayurveda people never notice. If they notice, if they start become together, if they start a little bit more study, they can do their own study. They don't need to ask me. If they do that one, then we can do more Ayurveda people. Thank you very much. You came here to my clinic. Namaskar, Sat Sri Akal. Hope this video you like. Spread it to other people. Thank you very much.